My name is Whitney Waters. I'll be doing a head-to-toe assessment. My dad is going to be my patient. He's helping me out today. If you have any questions, let me know. I'll try to walk you through each step as I'm doing it.
Okay.
So we'll begin with alert and orientation. So can you tell me your full name?
David Hansen.
Can you tell me where you are?
We are in Lake Shore, Utah.
Can you tell me the year?
2020.
Okay, perfect. Okay, so then we'll go to cranial nerve number 1, and that's your sense of smell. And so I'll have you close one nostril at a time while I bring a scent to each nostril, and you tell me what it is. Okay? And close your eyes too. Okay, ready?
Yep. Peppermint.
Yep. And the other one?
Orange.
Yeah. Okay. And then we would assess cranial nerve 2, which was already been done. We used the Snell and eye chart, and your vision was 2010. So we're done with that. And then we'll do cranial nerves 3, 4, and 6. So I'll have you raise your eyebrows up and down for me. Okay. And then we'll assess extraocular eye movement. So I'll have you keep your head forward, looking at me, and just follow my hand with your eyes. Okay, and then we'll assess PERLA, which is pupils equal round reactivity to light and accommodation. So I'll assess one at a time, seeing how the pupil responds to the light. So have you keep your eyes open for me, and okay. And then I would also assess the red reflex. I don't have the tool for that, but I'd use the tool and have them look over my shoulder as I assess for that. Okay, and now we'll do cranial nerves 5 and 7. So I'll have you smile for me. Smile, frown, and then I'll have you open your mouth, bite down. I'll assess for TMJ, so you can open your jaw, okay? And then I'll assess the sensation, so can you feel this?
Yes, yes.
Okay, and then I'll have you stick out your tongue for me. Puff out your cheeks. Okay. And then we'll do cranial nerve number 8, which is auditory. So we're gonna assess your hearing. I don't have the tools to assess conduction versus air, so I will just whisper a word in your ear as you're closing the opposite ear, and tell me what you hear. So close that ear.
Apple. Orange.
Okay, perfect. Okay, so now we'll do cranial nerves 9, 11, and 12. So that has to do with inside of the mouth. So I'll have you, again, open your mouth for me. While you're doing this, I would look at your mucous membranes, making sure they're pink and moist. Look at the teeth. Open again. The pharynx, the uvula, the gag reflex. Can you say ah?
Ah.
And then I'll assess swallowing. So I'll have you swallow for me. And while he's doing that, I would assess the thyroid. So swallow. Okay. And then we'll also assess the lymph nodes. Any tenderness?
No.
In the occipital area. Okay, and then we're gonna assess cranial nerve number 11. So I'll have you shrug your shoulders for me. Okay, assessing your strength. Okay, and then hold out your arms for me. Resist. And forward. we've done all the cranial nerves. We'll move on to rapid arm movement. So I'll have you alternate your hands up and down for me quickly. And then, yeah, one at a time, alternating. Okay, perfect. And then we'll assess graphesthesia and stereonovus. So have you close your eyes and tell me what I'm writing on your palm.
Letter A.
Okay, and then keep your eyes closed and tell me the object that you feel.
Safety pin.
Okay, perfect. So now we're gonna assess the cerebellum, which is balance. So I'll have you stand up for me. Close your eyes. We'll do the Romberg test. One knee up and another knee up. And then open your eyes, do it again. And again. Okay, and then heel to shin. And then have you walk on your heels a few steps towards the camera. Walk on your tippy toes. And then just a normal few steps for me. Okay, and then during this part, I can assess for scoliosis, so I'd feel the curvature of the spine. And I would also assess for CVA tenderness, which is kidney pain. Any pain here? And vertebrae tenderness as well. So, and then have you turn around for me, stretch your arms out, touch your nose with your finger. Okay, and then touch each finger with your thumbs. Perfect. Okay, and yeah, you can sit back down now. So now we'll just go through head to toe, just a generalized assessment. We finished balance, we finished all the cranial nerves. So I'll assess the head, I'll look at the texture, feel the texture, look at the scalp, see if there's any abnormalities in the skin. As I'm doing this head to toe assessment, I want to be super aware of the skin for any bumps, redness, scars, anything unusual. And then we'll go to the face, again looking at the skin. So I'll assess the nose, look for any swelling, check the turbinates, the color, check for a deviated septum, and then we'll move towards the ear. I check the tympanic membrane. I would use the tool to look inside and it should be a pearly gray. I would check each ear. And then again, checking the mouth, like I did with the cranial nerves, making sure the inside of the mouth is pink and moist. Swallowing, gag reflex, everything that we did with the cranial nerves there. And then we'll assess the neck for symmetry. And I'll feel the carotid pulses on each side. Okay, and then I'll also listen with my stethoscope to the carotid pulses for any bruits. Okay, and again, looking at the neck for symmetry, we assess for TMJ. We can do jugular distension, so I'll have you turn your neck towards me and the other way. Okay, so now we'll move down the thoracic region and we will do lung sounds. So, let's see. So you need to do posterior and the front, but I'll just do the back for this assessment. So I would first assess for tactile firmitis. So each time I tap your back, I will have you say 99. Okay? And now.
99, 99, 99, 99, 99, 99.
Okay. Again, I'll have you say 99. I'll assess bronchophony and I'll listen for consolidation.
99, 99, 99, 99, 99, 99.
Now we'll assess ego, phony, so I'll have you say E each time I listen.
E, 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 E.
Now we'll assess vestibular paraquili. It's hard to say that one. So I'll have you whisper 1, 2, 3 for me, okay? 1, 2, 3. You whispering? Okay. Okay, just making sure.
Yep.
Okay, and then I'll just do a general lung sound assessment. So I'll have you do deep breath in and out. And I would do that along both sides. Now we'll listen to your heart sounds. We'll do aortic, pulmonic, second pulmonic, which is the herb space, tricuspid, and mitral. Okay, so we finished the heart sounds and the lung sounds. We'll do a quick extremities assessment now. So again, I'll look at your arms, look at the skin. We tested your strength. Look at your legs. We'll assess the Homan sign. So I'll have you put your leg out straight for me. And then any pain there. And then I'd also assess for clonus, which is the reflex of the foot there. And then I can do the rest of your pulses. We've done the carotid pulse. So I can do the radial pulses on each side, popliteal pulses, underneath the knee, and dorsal pedal pulses. And then we can also do reflexes. I don't have the tool for that, but we would do the triceps, which is here, and I would tap here, and then the bicep here, and then the brachioradialis here, and then patellar here, and Achilles here. And again, as I'm assessing the extremities, I'm always looking at the skin and looking for any edema. Okay, so I've done the reflexes, lung sounds, heart sounds, cranial nerves. So now we'll just finish up with bowel sounds. So I'll have you lay back for me. Over here. Okay, so I'm going to listen to your bowel sounds in all 4 quadrants and the aorta for 1 minute. I won't really listen for that long for time, but.
Okay.
So I'll have you put your arms to the side for me. So I'm listening for the clicking sound. And the aorta for 1 minute. Okay, so it's really important before an abdominal assessment to inspect first, and then, so I'm going to inspect the abdomen for any noticeable masses or any abnormalities, again looking at the skin. I'm going to percuss the liver first before palpating, so I'll have you take a big deep breath in and out. So I palpate the liver, feeling the margins, and then I'll also palpate the spleen. So do big deep breath in and out. Okay. And then again, I'd want to percuss each area, and this is an advanced skill. And then I want to palpate lightly, and then deep palpation. And we want to make sure that the patient empties their bladder before you do that for their comfort. And so you can sit up. We have, I think we've finished up. So we did the cranial nerves, lungs, hearts, overall head to toe. So thanks for helping me out, Dad.
No problem. And